The Office of Diversity and Inclusion at the Wayne State School of Medicine welcomes you to the ODI Speaker Series. The ODI Speaker Series grants students, staff, faculty, and community members the opportunity to explore themes regarding health disparities, health advocacy, and health education. Our guest speakers are physicians and surgeons from across the state of Michigan with various areas of expertise. You can ask our guests any questions by completing the RSVP form in our invitations, and our guest speaker will answer your questions live. If you have any questions, concerns, or compliments for the office, please contact us via email at diversity@med.wayne.edu. For more updates on events like these, please follow us on Facebook and Instagram at WSU-SOM Diversity. If you are a Wayne State student looking for more ways to get involved, please visit our Get Involved webpage at getinvolved.wayne.edu/ODISOM. Today, we have Dr. Maureen Connolly, a pediatrician with the Henry Ford Health System in Highland Park, Michigan. During this seminar, she will share tips for how you can provide inclusive and affirming care to the LGBTQ community.
So I'm so excited to be here. As Lewis mentioned, I'm a pediatrician with Henry Ford Health System. Focuses on caring for adolescents and young adults. So now we're going to talk a little bit about sexual health, and we're going to get to the great question around asking patients that may be relevant to their biological sex but may not align with their gender identity. So the first thing I'll say, again, for those of us who are in healthcare on the call, sexual and romantic attraction is a normal part of life. And if we're comfortable talking about stuff, our patients will be comfortable talking about stuff, right? So it is worth practicing. No patient, if I come in and I'm just like, so are you sexually active, right? Like that, like no one's gonna want to talk to me about their sex lives, right? So really emphasizing that this is a normal part of life. This is taking a sexual history, the 7 Ps. The first I'll say is positivity, right? So again, this is normal. You know, maybe people are having sex, maybe they're not. All of that's okay, right? So really just coming from it with positivity, as opposed to sometimes the shame or, you know, just shame really that can be associated with talking about sex in our culture. Partners. So I will ask, so again, typically if I'm seeing a patient, I will generally, you know, if they're coming to me for transgender care, or, you know, in the context of asking their pronouns, there's an indication that this person might be transgender. You know, we're talking then about kind of getting into some of this while we're talking about partners. So who are you attracted to? Do you date guys, girls, everybody, nobody, right? Kind of tell me a little bit about your partners. And then I will really get into, you know, number 3, practices. So what part of your body are you using for sex? What part is your partner using? You know, really kind of asking folks to get into that. And I will preface this with, you know, we're going to talk about love and relationships. These are some sensitive conversations, but they are important to thinking about your health. You're always free to not answer any of my questions. I kind of just always kind of preface that to give people some agency in these conversations. But then I will say, you know, are you using your vagina for sex? Are you using your butt for sex? Are you, you know, having oral sex? I'll say, do you top or do you bottom? I mean, these are all kind of like just normal parts of exploring someone's sexual activity and really getting a sense of how people are getting down. Protection, talking about condom use. I will say if a patient says, oh, I'm using condoms, 75% of the time, I think as a medical provider, I'm like immediately zeroing in like, okay, so what about that 25% when you're not using condoms? But I would just remember to take a pause and celebrate the fact that a patient is using condoms 75% of the time, right? I don't think we ever give enough credit to people who are navigating their sexual health and taking those steps to be safe. Past history. You'll learn in medical school, if you're a student, to ask about how many partners someone has had in their lifetime. I will say, especially if you're working with teenagers, there's no number that anyone is ever going to feel good about, right? So like if you ask a 17-year-old, how many people have you had sex with? Either it's going to be too many or too little. You know, I'm just not sure that that's a super effective way to get at it. I will say, like, how many people have you had sex with in the last 3 months as kind of a way to be like, okay, like, you know, maybe we would talk more about starting PrEP or making sure we get on birth control, that type of thing. We'll talk about PrEP in a second. Pregnancy plans. I never, ever assume someone's desire to get or not get pregnant, right? So I will say, like, are you trying to become a parent right now, right? I think sometimes we always assume that teenagers don't want to get pregnant, and we jump to, so what are you using for birth control, without first exploring, what their pregnancy desires are. Regardless of their gender identity. I think that that's super important, because that is going to, again, help us do that patient-centered care. And then pleasure. Do you like having sex? We never ever ask this in healthcare, right? And I think especially for teenagers and young adults, that can give you some really important information that might be worth exploring. Like, I don't like it as much as my boyfriend, but I'm staying at his house right now, and I kind of feel like I just kind of got to do what he wants. Or I don't like it, but my partner is paying rent right now. So, that's kind of, so exploring some of that, I think we can start talking about issues of like consent and communication, which at the heart of it, in addition to condoms and birth control, consent, communication, that's actually central to healthy sex as well. So I think it's worth exploring. Again, going back to the very first question, is there time to do all of that? Probably not at every visit. So I'm not like going through all of this every single time I see a young person. But if they're coming in for a sexual health concern, this is the focus of my history and what we're talking about.